taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenoir and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch.
Good health and welcome to today's edition of the Wellness Watch. I'm your host, Dr. Mike Lenoir. We have discussed Alzheimer's disease in previous discussions, its impact on all communities, and specifically the African American community. But like any chronic disease, much of the burden of Alzheimer's falls on the caregivers. And so we need to discuss that and maybe bring some clarity to that responsibility in ways in which people can navigate that. And we happen to be with the right person at the right time, Mr. Mark Loupe, who is the chairman of the board of the Northern California chapter of the Alzheimer's Association. Welcome, Mr. Loupe.
Thank you.
You know, everybody talks about the disease itself, but especially with a disease like Alzheimer's, where people are mobile and confused, a lot of this falls on the caregivers. Am I right about that?
You're absolutely right. You're absolutely right. And if I can just, make it personal, and I know you and I have talked about this before, most caregivers, if they happen to be a person who is employed, it puts a lot of stress on a person trying to do their day job, if you will, trying to take care of someone. And it can adversely affect a person's stature in the organization that they're working, irrespective of the title, irrespective of the level. It could be an executive or it could be all the way to throughout the organization. And that means that the person may have to leave work early, may have to spend extra dollars, if you will, for caregiving, going to the doctor, all types of reasons. But at the end of the day, the person who is employed is not as productive as they would if they weren't doing the caregiving. And so that has a direct impact. And so there have been tremendous studies shown that caregiving at the job is impacted. The other dimension is the emotional dimension. Caregiving, because of someone who's doing the caregiving, if they happen to be a family member, they're very emotionally connected. And so they get the anxiety, their stress. Caregivers need respite because sometimes they're so in love with the one they're caring for, they neglect their own health. And therefore, that could have other damaging effects them. And then if their health is at risk, then the one they're giving care for is at risk also. And then also is how do they deal with the emotional side? You're a doctor, so you've seen all types of patients. An Alzheimer's patient is a little unique in terms of the type of behaviors. Person can be disruptive, can be physical, can be moody. I'm not taking away from any other diseases, but because those attributes can be there too. But it's much more prevalent in the Alzheimer's disease area, where those mood swings can be quite challenging for a person who's not well equipped to deal with those. They can love the person, but if they're not well equipped to deal with those emotional swings, they're at risk.
And I can imagine there must be a lot of burnout.
That's exactly what I mean. You're absolutely right. And the burnout, and what's also important is recognizing the burnout. Person is so involved in the caregiving, sometimes they don't know that they're burned out, but they're stressed, they're not feeling well. And sometimes they can get, very stressed about the matter.
Yeah, I think burnout is one of the bigger problems, and not only just caregivers, caregivers who are professional, as well as caregivers who are personal and family.
That's right.
Because they don't expect to have to deal with these kinds of things. They just want to provide care. But when you start to look at all the other things that are required just to give that care, I think that puts a lot of stress on the whole system.
Yeah, if I can add to that, Mike, it puts stress. You're absolutely right. And the stress can go away at times in certain areas when there is a viable solution All right. The challenge with Alzheimer's and other similar diseases, when they're not quote unquote curable, that adds another dimension on the stress where there's no end in sight. And therefore, that creates tremendous amount of stress for the caregiver.
Now, you work with a lot of caregivers, and you study the process probably as much as anybody that I know. What are some of the strategies that you recommend for caregivers to be successful and to prevent some of the things we just identified?
Well, since we're talking about Alzheimer's, I would say that there is a wealth of information provided by the Alzheimer's Association, and it's free. So there's no big, and I find that when a person has access to good, reliable, credible information, that reduces it for me. And I talk to a lot of other colleagues of mine in the organization who have been caregivers too. Having someone to help you navigate, because you can't ask a friend. I mean, unless the friend is an expert in the area, and very few. And so having some place to go and be able to say, here's what I am dealing with, whatever it may be. It could be the financial struggle. It could be access to a good primary physician. It could be access to a memory care facility. It could be access to whatever your loved one needs. So I would say that's one major strategy, because the disease affects caregivers in different ways. So it's not like just one type of way to solve, but having access would be my strong recommendation to help a person navigate.
Do you think it's important that there be more than one caregiver? Because
yes, I would say the answer is
job.
Yeah.
And with someone you love, and they usually, in my experience, they get pretty bitter about that situation, and they take it out on the caregivers, and they pose almost a threat to walk away and do other things. I always thought that maybe it would be better if someone could divide the job up. I mean, obviously, someone who needs 24 hours.
You're so correct, Mike. It's so correct. It's too heavy. It's too much of a burden for one individual, and so spreading the duties among family members or other. It doesn't have to be blood family, but you're right. Having multiple caregivers, people who have responsibility. I would say, in my experience and what I've seen, there is what you would call a primary caregiver. All right, a primary care who can make sure all the pieces are fitting together and understands. But that primary caregiver needs the respite and so there is someone who has a primary responsibility for a certain area. For instance, my brother, I have two older brothers. All right. And I live in Northern California. My mother and brother were living in Las Vegas. And so I had a brother in Las Vegas who was able to do some of the quote unquote heavy lifting. I have another brother in Los Angeles at the time who helped, and we would trade off. So even though I was kind of navigating a lot, I had support. And if I didn't have that support, I would have had to seek it elsewhere because it was too much for me to do on my own.
One of the interesting pieces of that is that it always comes a decision at home or in an assisted living facility. How's that decision? What goes into that decision?
Going to a facility?
Either staying at home with Alzheimer's or being in an assisted living facility.
That's an excellent question, Mike. I would say I would answer it in a couple of dimensions. There is first the decision. Does the person who has Alzheimer's, should they stay home or should they go to a facility? The question you just asked me. The first thing is there are, in certain situations, a primary care person may get feedback, shall we say, from others that, no, we don't want, let's call it my brother, all right, or a mother, it doesn't matter. Should he or be taken care of at home? That has certain levels of stress, economics, and then a facility. It's going to be expensive, all right? But depending upon the stage of the individual, but there's always, I would call it, the first question is the emotional decision. Certain family members say, we don't want our loved one to be in a facility. Or some say, we need a facility because we're incapable of taking care. But that is at first an emotional decision, and sometimes it's coupled with the financial decision too, on how to take care of. Just because a person stays home versus going to facility, sometimes that person may need similar services at the facility at home.
Well, I think that's important. It's important that we talk about this because so many people are facing a situation as caregivers, and Alzheimer's, I think, forms a perfect template for understanding what those needs are. We have seen in my own family, of course, my mother had dementia for a long time, and it can divide families. About who's going to pick up the gauntlet.
That's
It
right.
can divide families on whether we keep her at home or not. It can divide families on assisted living. I'm fortunate, and I think most people are fortunate, those of us who have long-term care insurance, because when I have a brother with Down syndrome, when he became a single individual, it was $5,000 or $6,000 a month.
Mhm.
So I don't think that's always an option for a
That's
lot
right.
of people, although there are programs for assistance. So, Mr. Loupe, thank you so much, not only for this conversation, but for your commitment to Alzheimer's, and specifically your commitment to the importance of this disease and its management, understanding and management in diverse communities. So we appreciate you taking the time, and we will speak to you as these things on Alzheimer's roll out, as you roll out your agenda as the chair of the Northern California chapter of the, I don't know whether to congratulate you or not, of the Northern California Alzheimer's Association. We appreciate you and thank you very much. All right, well, thank you, Mr. Loupe, for joining us today. I mean, obviously, having a person of color in that position improves the quality of health for everyone in this community. And so I think we've done a couple programs on Alzheimer's, and I want you to look at those because almost every family faces some form of dementia and certainly some form of caregiving. So thank you for joining us. And as we always say, when we conclude our program, health is your biggest asset. So please protect it.